Ceann Comhairle Tánaiste. Again, we read today that the people who have health insurance are now facing a further 15% hike in their health insurance premiums from the 1st of July. This means now that the average premium for 2 adults and 2 children will have doubled in the last 3 years to €2,500. This is a result of legislation that's coming in July, will be responsible for the hike that's about to come in. The government wants to raise about 60 million and wants to charge the full cost for private patients using the public health system. In essence, it's putting an unsustainable burden on individual families. People pay their taxes under the 1970 Health Act. They essentially are entitled to treatment in acute hospitals. They pay a second contribution through health insurance. The problem, Tánaiste, is fundamentally that the continual price hikes are threatening the sustainability of the health insurance market. I mean, the Health Insurance Authority estimate that 90,000 will leave in 2014, 68,000 left in 2012. About 6,000 a month now are leaving the health insurance market. And because we have a community rating system which depends on younger subscribers cross-subsidising older users of the system, it's clear that the younger members are not taking up the premiums or are leaving, and that this is placing huge strains on the sustainability of the health insurance market itself. Now, that's in the context of a universal health insurance model, or the Dutch model, that was proposed by Minister Riley and indeed the Taoiseach before the last election. We are nowhere near the realisation of that. No white paper has been published. And what I want to put to you, Tánaiste, do you accept that the situation is not sustainable, that the cycle we're now in is a cycle that essentially is the beginning of a cycle that could spell the death knell for the private health insurance market? I'm not saying that. I think analysts are saying that. The Health Insurance Authority are putting out warnings in relation to that. And that something has to happen in terms of the overall plan to intervene, in essence, to stop what is, in essence, a death spiral in the health insurance market.
Well, first of all, what is being proposed is that the cost of a public bed in a public hospital should be chargeable to the insurance company where there's insurance involved. As we all know, the private health insurers charge for everything: the consultant, the anaesthetist. They'll charge for the bed if it's a private bed, but the hospital cannot charge at present for the use of the public bed, and that's what's being proposed. The amount of money that it is proposed that will raise is, as you say, 60 million this year, against a total payout by the insurance industry of 2.2 billion. 60 million does not amount to a 15% increase in premiums, even if it were passed on. So, I think there is great exaggerated statements being made about that. The government, as you know, is undertaking a major reform of the health services to reduce the cost of delivering these services, and the Minister for Health will shortly bring forward his proposals on hospital groups, which will streamline services for patients, and Minister of State White is overseeing a chronic illnesses programme which will see patients treated more cost effectively in primary care settings rather than expensive hospital settings. We're doing this also while having, of course, to reduce the budget for the health services due to the state in which you left the country, Deputy Martin. Private inpatients in public hospitals are subject to maintenance charges that generally range from €586 to €1,046 per day when they are accommodated in a private or a semi-private basis, and this charge is separate to the private consultant fees which a patient also pays. About 20% of beds in public hospitals are designated as private beds. The other beds are designated as public beds, with the exception of a small number of beds which aren't designated. If a private designated bed is not available and a private inpatient is accommodated in a public bed, the maintenance charge is not levied. As a result of this practice, hospital maintenance charges are not payable by private inpatients occupying public designated beds or non-designated beds. So the change that is being proposed, and which is in the draft legislation which is coming forward, is to provide for the charging of the public beds, and I think that makes sense. I mean, if the hospital can charge for the private bed, it ought to be able to charge for the public bed, which is rather than having the entire cost of that fall on the taxpayer.
Public hospitals have always been charging health insurance companies. What's proposed now is at the full cost. But the problem is being done in a vacuum and without any overall solution coming forward in terms of the issues that face the funding of the overall health service. I mean, people pay their taxes. The average health insurers are taxpayers. They're not super wealthy people. They're average families that have taken out health insurance. That's been a tradition. It's been part of our system for a long time out. And many people will be very surprised that your description of the price hikes has been exaggerated. I mean, this is the third hike now that will happen this year. I mean, people are feeling it out there. They'll be amazed at the idea that somebody thinks that the price hikes in health insurance are somehow exaggerated. I mean, 6,000 people are leaving a month. 90,000 will leave between now and 2014. 68,000 have left in 2012. And the question I asked you is that because the sustainability.
The Taoiseach will reply.
With respect, Minister Abbott.
Just make your point. Thank you.
Leader's question. You were leader once. You're not
Thank
now.
You. Yeah,
I would appreciate that I've been able to ask the Taoiseach the question.
Thank you.
Because the people were promised that there would be a universal health model introduced. Right? They were promised the Dutch model. We haven't even had a white paper in relation to that. People were promised the sun, the moon and the stars. This would be a painless approach to accessing health services and the funding of health services. The Dutch model was held out as the great sort of solution to all our ills. And we still don't know whether people who have health insurance now will be paying less under the Dutch model, or people on medical cards will be paying more, or people, the 20% who have neither health insurance or the medical card, where do they stand? But in the meantime, the centre cannot hold Taoiseach, is the point I'm making. And I'm not saying this alone. The Health Insurance Authority are warning that the sustainability of the market is at risk. The other analysts are also saying that the market is heading into a death spiral because of adverse selection risks. Essentially, younger people are leaving in their droves. They're not there to cross-subsidise older members of the health insurance market, and we are heading into a significant downward cycle. And that needs to be addressed. And all we've been told is it'll be 2016 or 2017 before we can even contemplate the universal health insurance. So I think there's a genuine issue there that demands some meaningful, substantive response as opposed to just the politicking that goes on.
The reading has improved since you went into opposition.
Taoiseach, please reply. Thank you.
First of all, I did not say that the increases in health insurance premiums are exaggerated. That's not what I said. I think the increases in health insurance premiums are staggering for families, and I think that there is a huge issue in relation to that. What I said was that the charging for the public beds in public hospitals, which is being proposed, which will yield 60 million this year, on a total payout of 2.2 billion in total by the insurance companies, no matter how you do the sums, does not amount to a 15% in premiums. And I'm saying that those who suggest that are exaggerating the impact of the effect of the charging to the insurance companies of the cost of public beds. That's what I said, and you choose to twist that obviously to make a political point. But let's be very clear about what I did say and what I am saying. I think that there are issues that have to be addressed by the insurance companies. I think there are issues relating to their cost base. I think there are issues in relation to the very high level of other charges which are charged to the insurance companies, including hospital charges and including charges by professionals and so on, which I think have to be addressed. And I think anybody who gets a bill from a health insurance company knows this full well. Secondly, I disagree with my colleague, Minister Rabbitte, that your reading has improved. It hasn't, because on the 15th of February, Minister Riley published a paper on pathway to universal health insurance, contrary to the claim that you have just made, which provides a comprehensive update on the progress achieved to date and set out the main actions. It doesn't matter what you call it. It doesn't matter what you call it. What it does is that it sets out the progress that has been made to date and the main actions that is to be done. Policy paper on money follows the patient was recently published. The government is making progress on the policy of implementing universal health insurance, and incidentally, it was never claimed that it was something that could be introduced overnight. The transition to universal health insurance is a policy and a programme which is going to take time to achieve, as you well know.
Thank you. Deputy MacDonald. Thank you.
Taoiseach, if the updated stability programme you published during the week showed anything, it was that austerity isn't working. Yet again, you've been forced to revise down growth forecasts and revise upward unemployment projections. And right across Europe, people are waking up to the reality that austerity isn't working. And I note today the President, Michael D. Higgins,
No. We don't go there now, please. Don't go there with regard to the President. We do not discuss the President in Dáil Éireann. So
citizens out there in the real world have been pushed to breaking point, and now you tell them that there's 2 more years of austerity on the way. The stealth taxes, the family home tax, cuts to child benefit, taxing maternity benefit, all have a real impact on low and middle income families. So people need a break, Taoiseach. So Taoiseach, if the state is due to meet the deficit targets with $1 billion or more to spare, then this money needs to be used to give people a break, to ease the burden on citizens. So I want to raise with you just one section of people who are suffering, and that is the carers in this state. I think perhaps the most mean-spirited cut made in the last budget was the cut of €300, or a 19% cut in the respite care grant. I believe at the time of the budget you couldn't defend on any level that nasty cut, and I think to this day nobody with a bone of decency in them could stand over it. The cut would save the state only €26 million in total, but has caused real hardship for the 70,000 families who are in receipt of it. So I want to ask you, Taoiseach, why don't you use the breathing space that you tell us we'll have to reverse this particular cut, the cut in the respite care grant? €26 million. If you claim that we will have over $1 billion to spare, $1 billion in advance of targets, can you give the carers of this state some comfort, some respite, and can you reverse that cut?
Thank you. Taoiseach.
Well, can I say, first of all, that there wouldn't be any breathing space at all if the government had followed the prescription advocated by Sinn Féin. At the time that this government was formed, your leader proclaimed that the IMF should go home and take their money with them. Now, if that had happened,
Sorry, please. Thank you.
If that had happened, there would have been 5 months. There would have been 5 months' money left to pay for all public services in circumstances where the government, at that stage, when we came into office, was not able to borrow on the private markets. I don't know what you would have recommended that we would do for money. The reason that there is now some breathing space is because of the way that this government has managed the country's finances and the economy. And we are making a recovery. And that recovery, for example, was, I think, very adequately illustrated this week with the numbers of new job announcements, because that's what is at the root of economic recovery, is the creation of jobs. Another 100 jobs in Waterford today, 100 jobs announced yesterday in Dublin, 1,600 announced for the development in Glanbia. There will be about 1,000 construction jobs on the development of the M7 and N11, which have also been announced. That's the way that we will get economic recovery. Now, it is, of course, a fact that there is a debate in Europe and throughout Europe about the economic strategy that is to be pursued. Austerity, as you call it, is not some kind of a choice. What the government is about doing is about ensuring that we have a solvent country, that we're able to pay our way. It is an unfortunate fact that as a country we are still borrowing about €1 billion a month in order to pay our way, and we do have to get the deficit down. Nobody is under any doubt about that, unless you live in some kind of a fairy tale existence, as Sinn Féin seems to have. But the recovery that needs to come is not a recovery that is based solely on budget adjustment. That is obviously part of it, because we have to get the deficit down. It is also based on creating the circumstances where there will be investment in the country, jobs created, and we grow our way out of it. That is the government's strategy, and that is the strategy that this government has been advocating at a European level, and I'm glad to see that more are taking heed of that, and that the European policy overall is adjusting more to that strategy that we've been advocating for some time.
Thank you. Deputy MacDonald.
Well, firstly, you see, your problem is that you've had to adjust downwards again the growth projections. So that gives the lie to the fact that your strategy is working. You've also had to revise upwards the unemployment projections. So don't come in with your own fairy tale that all is well. It's not. And by the way, nobody ever contested the fact that the budget deficit had to be tackled. We produced proposals to do precisely that, but in a different way. Can I tell you this much, Tánaiste, that whatever about your fairy tale, it's no fairy tale for carers. It's no fairy tale for carers. Because, as you know, home help hours have been cut by over 1 million hours in the system in 2012. Prescription charges have gone up. But really, the salt in the wound was this mean cut to the respite grant of €300 or almost 20%, which would yield a saving of 26 million. Now, you boast about the breathing space. So use the breathing space. And when you stand up again, can you please address the issue of carers and the respite grant? It might interest you to know that the carers have now launched a campaign.
Thank you.
It's called Give Carers a Break. And they set out, in very stark terms, the effect that this cut to the respite grant has had. You have Carolyn caring for her mother, Antoinette and Sam caring for their daughter and sister, respectively. And they set out in very clear terms, real terms, no fairy tales, Tánaiste, real terms, the effect that that particular cut to the respite grant has had on their lives.
Thank you.
Cutting back on heating, cutting back on food, a real material damage to the lives of carers and those that they care for. So I'm asking you very simply to reverse that particular cut. It's only one of the cuts that have hurt carers.
Thank you.
But for 26 million, to reverse that cut, which I don't believe you could ever stand
to respect the chair again. Would you
even
please respect the time restraints that I have to impose? Thank you. Tánaiste.
I don't need any lecture from you, Deputy MacDonald, on the important work that carers do. I have some personal experience of it. So please don't give us that kind of pompous lecture. The work that carers do is hugely important and valued, and that's why this government, unlike its predecessor, has published a carers strategy. And that's why ministers in this government are working to support carers and will continue to do so. I'm glad to hear you say, and it's the first time that I have heard from Sinn Féin, that you now accept the target of reducing the deficit to 3% by 2015, because you haven't been saying that, and it will be interesting. It will be interesting to see what proposals come from Sinn Féin in the run-in to the 2014 budget. I look forward to seeing those, because I have answered you on the respite. I've answered you on it. I've answered you.
Would you mind addressing your remarks through the chair, Deputy MacDonald? It's a normal courtesy, in case you don't know it, that it exists in this House. Thank you. Deputy McGrath, resume your seat, please. Deputy McGrath, no, you can't. Resume your seat. Thank you. Resume your seat, I say. I'm not responsible for the replies. Resume. Deputy, I won't ask you that. I won't ask you a second time to resume your seat. I won't ask you a second time. You're expected to respect the chair like everybody else. Deputy McGrath, thank you.
Gormagot, Concola. Taoiseach, yesterday the heads of the protection of the life during pregnancy bill was discussed in this House. It was condemned by some as a positive compromise and condemned by others as not going far enough. I want to suggest that both approaches are seriously flawed. Indeed, the very content of the bill in its current form undermines the very rights that it sets out to protect. I raise this with great respect, and I hope to get respect. I want to speak on behalf of the people.
Would you please allow the deputy put his question? Thank you. I know, I'm deal with it. I'll deal with it. Please. Now, deputies, will you stay quiet? Deputy Lawler, please. And I won't ask you again a second time. Now, please. Now, would you please, Deputy Martin, would you please allow me to do my job and you do yours? Thank you. Thank you very much. Deputy McGrath.
Councillor, I can say that I had to write to you last week, Councillor, and you do your job the best always, but it's not been allowed, it's not been fair on us over here.
I'm looking after it.
Cormac. It does this by framing a piece of proposed legislation which completely ignores the weight of medical evidence and which demonstrates beyond a reasonable doubt that abortion as a treatment for suicide is harmful to women and favours an ideological position not supported by facts. Taoiseach, it is also proposed that certain hospitals will be designated to perform these so-called terminations. But what will be the position if the hospital refuses to perform these terminations? If it conflicts with the established ethos of those hospitals, as set down in many cases by contractual agreements between the HSE and indeed those hospitals. What then? The bill contains a conscientious objection clause for individuals, but will the same apply to institutions that cannot in conscience perform these procedures? I suspect this is simply one more demonstration that the bill is profoundly unworkable and risks an enormous level of government intrusion into the practice and integrity of our health system. The whole situation speaks to the lack of equality between the lives of mothers and the child, as laid out in Articles 43(3). The bill also requires that the abortion can only be granted in the reasonable opinion of 2 psychiatrists, that the risk can only be averted by this procedure. So it is asking psychiatrists for a reasonable opinion, despite the fact that the vast majority of them have already stated that this is unreasonable.
Thank you, Deputy.
Well, as the Deputy knows and the House knows, the Government have approved the heads of a bill which is intended to protect the lives of women during pregnancy. Every year, thousands of women in Ireland give birth. It's a happy occasion. It's a cause of great joy. But there are occasions when things go wrong. And in those cases, women are entitled to know that they will get the treatment which will save their lives. And the doctors who treat them also need to know that their position is clear when they take action to save a woman's life during pregnancy. The heads of the bill will be referred to the Oireachtas Committee on Health. I would invite Deputy McGrath to put the case that he has made here now and the issues he has raised to that committee, and indeed to take the opportunity when the bill is before the House to make the case that he makes. There will be a full debate on this bill in the House. There will be a full discussion of the heads of the bill at the Oireachtas Committee, and there will be plenty of opportunity for Deputy McGrath to make the points that he is making and to have them responded to by the Minister.
Deputy McGrath.
I am a member of the Health Committee, and I was at the meeting this morning, Taoiseach, and I will be making those points at that committee also. But I do hope that the Health Committee is not just going to be a stalking horse for the legislation, and that we will be listened to, and the people who come before will be listened to. What is it that persuaded you, Taoiseach, to include a provision for psychiatrists to arrive at a position which they have already stated is not supported by evidence? In practice, will this not seriously limit the pool of mental health professionals who will participate in such a process, and thus leave the door open to that tiny minority who believe abortion will serve the interests of women? The evidence of every other jurisdiction in the world has demonstrated time and time again that despite the best intentions of legislators, and regardless of the alleged restrictiveness of the legislation, no government has succeeded in preventing an abortion-on-demand situation from occurring once the principle of targeting innocent human life is accepted. I say that honestly. I want to ask you this in particular. An appeals mechanism on behalf of suicidal women refused an abortion is contained in the heads of the bill. Since the unborn child has equal right to life, will there be room for an appeal on behalf of the unborn child in the event that two psychiatrists, in the teeth of the relevant evidence, sign the child's life away? And can the Taoiseach give a commitment to this in the interest of equality?
Thank you. Taoiseach.
Well, can I say first of all that the Health Committee, when it held its hearings in relation to this issue at the early part of this year, did so in a very dignified and a very reasoned way. And I expect that the Health Committee now, in considering the content of the heads of the bill, will address it in the same reasoned and reasonable way. And as I said yesterday, I think it's important that this debate is conducted in a very reasoned and reasonable way. Deputy McGrath has a point of view in relation to the bill. You will have plenty of opportunity, Deputy McGrath, to air that view both at the Health Committee, of which you are, as you say, you are a member, and in the debate here in the House. I think that is the appropriate place for the issues that you have raised this morning to be teased out in detail. The bill has been worked on for some time. It's balanced, it's reasonable, it is within the confines of the constitutional provision, the judgment in the X case, the judgment that has been given by the European Court of Human Rights. There is obviously detail that has to be and will be discussed here on the floor of the House and at the committee, including the issues that you have raised this morning, Deputy McGrath. And I think, in fairness, I think that is probably the best place to have that discussed. That's what the Dáil is for, that's what the Oireachtas is for, is to debate and discuss the detail of legislative proposals, and I expect that there will be plenty of opportunity to have the issues which you have raised this morning, which are really relate to detailed provisions in the bill, to have them fully teased out, and there will be plenty of opportunity for that to be done.
Thank you. That completes the